My name is Dr. Victoria Partey-Newmann. I'm a medical doctor by profession, women's health advocate for the past 5 years and still going. I've engaged myself in several programs with respect to breast cancer screenings and cervical cancer screenings. And right after my house job, I started working at Stras Hospital. After a few months, my boss engaged me with a Woman Clinic where I was in charge of women's health in terms of preventive health, and we had opportunity to screen women's breasts and examine their cervix to rule out cervical cancer. Through this process, I noticed I had a strong desire to see women at the forefront of health and be proactive about their health and things concerning women issues. In line with that, I figured out that I had an interest in public health when it comes to women issues. I came to Ensign and I noticed the same passion I carried at my workplace was the same thing they did over here. And at Ensign College, you are engaged every day in assignments, presentations, and that's one of the things that has boosted my confidence and has boosted my level of believing in myself to give to society. Everyone is on you, your supervisor is on you, your supervisor is chasing you. Ironically, in other schools where you chase your supervisor, in Ensign, your lecturer calls you and finds out, where have you got into, what are you doing, this is your deadline. And then sometimes you feel offended because you have other things doing, but at the end of the day you realize it's for your good. I've also been I'm awarded the Young Scholarship apart from the AAPHP scholarship, and you wouldn't get it from any other school apart from Ensign. And our lecturers are very generous to give you the opportunity. They'll just send you the link to apply. And it was through this application that I applied for the AAPHP scholarship, and I got the opportunity to win the scholarship. Doing your project is very cost intensive, and the scholarship offers you the opportunity to do your project and gives you provision of the things you need, the resources you need for it. Surprisingly, my topic was in relation to women's health. I chose the cognizance of cervical cancer amongst community health workers in relation to the service delivery practices of cervical cancer in Krobo Enclave. And it was specifically for community health nurses because I feel community health nurses are the grassroots. They are the main people that relates to the people in the community. So if they are abreast with the knowledge, the level awareness of community of cervical cancer, they'll be able to pass on to the women, and that's the whole focus. If we practice preventive health care, whereby we are ahead of the disease, we take charge and then we examine ourselves before it manifests, I think we would, to a large extent, reduce the incidence of cervical cancer or breast cancer.